Mandate Health Empowerment Initiative, a non-governmental organization, has launched FCT in-school adolescent mental health capacity building projects for secondary schools. Founder of the initiative, Mr. Ame Abba, said 10 schools in the FCT would be selected for the project, 7 from public schools and 3 from private schools. He said the project would build the capacity of 200 students, 20 from each of the schools and 20 counselors from the 10 schools for 12 months. Abba, who commended the European Union and British Council for funding the project, said it would promote social inclusion of girls and people living with disabilities.
Most mental health problems diagnosed in adulthood begins at the adolescent stage. Half of lifetime diagnosable mental health disorder starts from the age of 14. The number increases and falls by the age of 24. The ability to manage mental health problems, including substance use issues and learning disorders, can affect adult functioning in areas such as social relationship and participation in workforce.
Mrs. Sheyi Tete, State Focal Person, FCT, EU-funded Agents for Citizen-Driven Transformation Program, said her organization was delighted to partner for the project.
There's a great need to create more awareness about mental health issues and its much needed solutions. The mental health issue is a global issue. According to the World Health Organization, WHO, mental health conditions account for 16% of the global burden of disease and injury in people aged 10 to 19. From the statistics, I'm sure we can all see that there's a very close connection between mental wellness and wholeness and a person's physical well-being.
Ms. Anne Alogu, the chief clinical psychologist of the organization, said the project will train school counselors to identify different mental triggers and give referrals when necessary.
So the people that will be involved in the project, the students, and also we are going to be training the school counselors. In psychology, what we do is to observe. That is how we study behavior, to know if something is off. So we are going to be teaching the school counselors on how to identify triggers. If there's a problem, is it the way the child dresses? Is it the way the child talks? Is the child withdrawn? We'll teach them how to look out for some of these symptoms that something is wrong and how to identify them and maybe give referral where necessary.
Chief Wakani Haruna, the initiative's Board of Trustees member, harped on the need to prioritize mental health and wellness.
Mental health issues have been so neglected over centuries, and this has led to stigma for sufferers. In most cases, we have seen hospitals for mental health issues are so located in very remote places. Just to tell you how stigmatized this form of disease is. It is like any other disease. And indeed, if our brain is the center of all operations of the human being, so if anything affects that, it means the entire system of body functions are impaired.
Jay Kekpele of Albino Foundation spoke on the importance of mental health for people living with disabilities.
I think if there's any group that needs it more is persons with disability. And now, of course, children are the ones that feel the brunt, because if the mind of a parent is not stable, it's going to affect the child. And so this is a project we in the community wholeheartedly endorse and thank the funding partners, the Arts British Council, funded by the EU, And of course, the organization responsible has shown commitment, integrity, and there is no doubt that they will be able to get the expected results.
The organization will partner with the Federal Ministry of Health, Education, Secondary School Education Board, and National Commission for Education Research Development to achieve its mission.